So you have an alternative to the CPAP. Tell me about that.
We do. Many of my patients have been diagnosed with sleep apnea.
Okay.
And that simply means that they're missing several breaths at night when they sleep. And this takes its toll on the body. And these people wake up, they don't feel like they've been resting at all. Usually they're doing a lot of snoring. It's driven them out of the bedroom. So it's not uncommon for especially a man to come to me and say, you know, well, I got to do something, okay, in order to get back, you know, into the bedroom. And so this is a person who will go to a physician, and maybe they will be treated with a CPAP, and their CPAP machine.
But those work.
CPAP machines work, but you know, they're not necessarily the best thing for the bedroom either.
Okay,
because it's
good
not
point.
the most romantic thing to be sleeping next to.
So it's an
their
airway
CPAP.
problem. Okay, so during the day, they breathe fine.
Right.
It's only when they lay down all of a sudden. So I guess there is a connection with.
When they relax at night, the soft tissue around the upper airway, mainly the neck, collapses into the airway.
Interesting.
So normally that airway is the size of a garden hose. But when they rest at night, then the airway becomes the size of a straw. And so there's less path, less circumference, if you will, for air to travel into their lungs. And so their body gets less air. Their body struggles all night long to breathe. It takes its toll on vital organs. The patient wakes up the next day. They don't feel like they've been resting.
So they think they're sleeping. Is that true?
Yeah, and their quality of sleep is so poor that these people fall asleep during the day. It's a major cause of motor vehicle accidents.
So what could you do as a dentist?
Well, as a dentist, we can make a device that they can use in conjunction with the CPAP that make the CPAP work better, or can totally replace the CPAP. And for those patients who have been diagnosed with this disorder and have been prescribed a CPAP and don't wear their CPAP for whatever reason, it's cumbersome, it's, you know, it's just, they don't like wearing it.
Okay.
Then they can have a device made that opens the airway, something that they wear in their mouth. It's comfortable. I wear one myself.
Oh, is that right?
Yeah, it's made a huge difference in the way I feel. I wouldn't sleep without it.
Have you ever had a patient that was on CPAP is no longer on CPAP?
Absolutely. It happens all the time.
Interesting. And so I know there's over-the-counter remedies for this.
Yes.
Why have a dentist make a custom?
If the dentist makes this, it's going to fit better. You're less likely to have problems that could alter the way your teeth come together, your bite, if the dentist is in control of making the device for you. You're going to get better results. It's just not worth it to save a few dollars to get something that may not work or may do some damage.
Okay, so set up a time, go in, get, and how, on the evaluation, can you predictably, with certainty, tell them you're probably a good candidate?
Absolutely. We actually do a home sleep study, and we can tell how severe their sleep disorder problem is, and we know within a range of sleep disorder problems who is the best candidate for these devices.